Good afternoon. I'm Sharon Sobol Jordan, President and CEO of the United Way of Greater Cleveland. Welcome to the third session of our 2023 Community Conversations series. The objective of these conversations is to provide a forum to raise awareness and increase engagement on important topics in our community. Each of our voices matters and has the power to create change. I would like to thank Ideastream Public Media for moderating today's session. I also would like to thank WOVU for simulcasting this afternoon's discussion live on 95.9 FM. And thank you to our community partners for their support throughout this series. Today's topic is the social impact of utility debt. Thousands of households in Greater Cleveland and throughout Ohio are unable to afford their basic household utility costs. 1 in 5 Cleveland Water Department customers are at least 1 month behind on their water bill. And more than 270,000 Ohioans had their gas or electric services shut off due to non-payment. As the operator of 211, we know firsthand the utility needs of our community members. Utility assistance is the second highest request from people calling our 211 program, over 34,000 calls in 2022. This year is no different as the cost of living and utilities has greatly increased. We have received an average of 1,700 calls for utility assistance each month. Our 211 program stands ready to assist individuals and families needing utility assistance. We are actively working with Step Forward and CHN Housing Partners to streamline the screening and application process for these important utility assistance programs. We are so pleased to have a panel of local experts here with us today to discuss the utility needs of renters and homeowners. We are privileged to have Stephen Langel as our moderator. Stephen is a reporter and producer for Ideastream Public Media and covers healthcare and health policy. Stephen was most recently the bureau chief of the Columbus Jewish News. Before coming to Cleveland, he spent more than a decade in Washington, D.C., covering health and environment beats. And with that, I will turn it over to Stephen to begin today's conversation.
Thank you, Sharon, for the introduction, and thank you, United Way of Greater Cleveland, for hosting this series of events and for inviting me to moderate this critical discussion. I also want to thank Ideastream Public Media and WOVU 95.9 FM, who will be streaming today's conversation. Just so everyone understands how we're going to interact as a community today, we will begin with questions I prepared for the conversation. There will be a public question and answer period that will begin at approximately 12:40 p.m. when questions for the community will be heard and shared with our panel. You can start asking your general questions at any time during today's program, and we'll make every effort to get all of them answered. You can text your questions to 216-307-5632. Again, that's 216-307-5632. Or if you're listening on Zoom, you can just type them into the Q&A box. And at this time, it's my honor to introduce our panel of experts. Today, we're joined by Genevieve Birkby, Program Manager for Rainbow Connects at the Rainbow Center for Women and Children. It's a social needs navigation initiative that's focused on women and children. Ms. Birkby's career is focused on public health with an emphasis on environmental, social, and community equity. Specifically, she's worked on healthy homes and lead poisoning prevention, asthma, tobacco disparities, chronic disease management, and most recently, social needs navigation and the social determinants of health. Next, we have Dr. Jacklyn Chisholm, the President and Chief Executive Officer of Step Forward, the largest community action agency in Ohio. Step Forward is a private nonprofit dedicated to transforming lives through education, personal and professional development programs, and support services. Additionally, Dr. Chisholm is the founder and chief executive officer of It's Worth It Consulting, LLC. My apologies. The author of the book Leadership Lessons, Notes from and for the Journey, and an inspirational blogger at drjacklynChisholm.com. Last of all, we have Tonja Stewart Shaw, Senior Outreach and Education Specialist at the Office of the Ohio Consumers Council. In this role, Ms. Stewart Shaw's responsibilities include giving speeches to community and professional organizations on a wide range of utility topics. Previously, Ms. Stewart Shaw was the low-income program specialist for the Public Utilities Commission of Ohio. And as such, she was responsible for overseeing all aspects of the energy assistance programs, percentage of income payment plan included, consumer protections, coordinating the annual winter heating season campaign, as well as conducting statewide training on energy assistance programs. Welcome, everybody, and thank you so much for taking your time to lend that expertise you have and your perspectives to today's dialogue. And now let's begin. I wanted to start with sort of a table setter, as it were. I was hoping, and let's start, Dr. Chisholm, with you, with what the reason might be for this problem affording utility costs.
Well, I think it's a multi-pronged problem. You have people who are trying to afford rent and mortgage, and then in addition to that, their utilities and food and clothing. But with utilities, it's very difficult. If you get behind, it's difficult to catch up.
I see. Anyone like to add to that?
I would just echo what Dr. Chisholm stated. With utilities, it's once you get behind, it's very hard to catch up, because the one thing that people must know with utilities is it keeps moving forward. So you may get a past due notice, but you then will get another bill with current, your current usage. So it's just a snowball effect once, consumers get behind, and it's difficult. They find themselves in difficult situations as far as getting their utility bills caught up.
And I was wondering if you might add a little bit about the long-term impacts of debt, as well as perhaps also the safety issues in play here.
Yeah, I think from where I sit, we're really concerned about the health impacts of not only utility disconnections and what happens if you are actually to the point of being shut off from your utilities, but also just the compounding stress that happens when you are worried about a pending utility disconnection, or you're really stressed out about the bill. What are you going to do? So, from a health point of view, safety-wise, you have very simple things like using your oven maybe to heat your house because you don't want to be cold and you're disconnected. So you turn your oven on and open the door, which could potentially cause a carbon monoxide issue. All the way to sometimes people will do things where they might string, their line to somebody else's in order to get some kind of power. Space heaters being tied up to things would be another one. And then we are really particularly worried about how it affects pregnant women and young babies, given our rates of infant mortality and maternal morbidity mortality in our community, thinking about what happens if you can't store your formula in a refrigerator or your milk because you have no power, or maybe you co-sleep because you're cold, the risks to a baby. And then what we know now about maternal stress, worrying about these things. If you're pregnant and caring for a child or have a child coming, what happens when that stress compounds on you? So that's the stuff we're most concerned about.
And let me give you an example. Last week, I received a call from a lady who received a disconnection notice, and she's on oxygen. And her biggest concern is if her electricity goes down, she's not going to be able to breathe. So this is, for many people, a life or death situation.
Absolutely.
I see. And I was wondering if we could perhaps speak a little bit about, especially given all of the potential threats and problems from this long-term and short-term, recommendations that each of you may have about working directly with utilities to avoid debt and default, ways to sort of address this. And if you might want to start.
Okay. So what we always tell people is when you know you're behind, the easiest thing to do is to get in touch with your utility company. See if you can make arrangements. Usually they're pretty good about that because ideally they don't want you to fall behind. But if you do fall behind, through Step Forward, we have utility assistance. It's our home energy assistance program. And so all you'd have to do is get in touch with us. You can go online, and our job is to help you. If you receive a disconnection notice, then you immediately go to the front of the line because we don't want your services to be disconnected.
I say, Ms. Stewart Shaw, if you'd like to add anything?
Yes, I would also echo what Dr. Chisholm stated. The first thing that consumers should do immediately is contact the utility company, ask for maybe a payment plan. The utility company will provide information on additional resources throughout the community. So Step Forward, CHN, even 211. But probably the most important thing that consumers can do immediately if they know that they cannot afford to make the utility bill payment that month, reach out to the utility company right away. I would also like to stress is if there is a medical situation in the home, consumers can contact the utility company and get what's called a medical certificate. A medical certificate are available. They're available for consumers who have a medical situation in the home where the disconnection of utility service would be especially dangerous to the health of any permanent member of the household. So a medical certificate will prevent a disconnection for up to 30 days. It will also reconnect service. So in the event that the service has actually physically been disconnected, consumers can get a medical certificate within 21 days. And that will actually help them get their utilities back on or prevent a disconnection. And then they can also reach out for additional resources in the interim while they have that medical certificate. So there are resources available. Again, I would say the most important thing to do is first and foremost, contact your utility company. Ask for a payment arrangement, ask if there are any available resources out there to assist.
And one issue that I believe I'd seen that you both, all of you actually mentioned previously, was this concern with the utilities being in someone else's name and how that complicates things. If you might speak to that issue.
You want to start?
Sure. Well, sometimes there's various issues as to why consumers may have utilities in someone else's name, and that could be, a situation that, maybe the person had utility service in their name, and then, that person moved out of the household, and, a person stayed and didn't get the utilities transferred. A lot of times it's difficult to get resources or even to make payment plans if the utility service is not in the name of the person that's, requesting the payment plan or requesting the resources. So, if consumers find themselves in a situation where, the utility service is in someone else's name, they should again reach out to the utility company and find out how they can get the services in their name. And that way, consumers would have better access to resources, payment plans, and, assistance out there.
So the difficulty we have is if a person has the utilities in someone else's name and that person didn't pay the bill and they try to get assistance through us, there's nothing we can do. So in effect, I think the expression is your name has been burned.
Oh.
And so we caution people, we recognize that some of that you can't help. But for some families, people have used their names, they've stolen their identity. And they find out when they try to get help through us. Yeah. So it's really just being mindful of the fact that if the minute someone else puts their name on your utilities, if they don't do what they're supposed to do, it will potentially affect your ability to get help.
And under those circumstances, is there anything that a resident can do to try to address that and move forward?
Well, I think you mentioned part of it. If the person no longer lives in the house, then you have to contact the utility company and get it switched over in your name. Unfortunately, if that's not the situation and someone has used your name or you allowed someone to use your name on another utility bill, there's really nothing that we can do because at that point, it gets flagged for fraud.
Right.
So you just have to be very careful about that.
The only other thing I could think one could do outside of the scope of the utility providers is potentially contact the Legal Aid Society of Greater Cleveland. I don't want to speak to all the ways in which they might be able to provide assistance with some of those issues, but they may at minimum be able to help provide some advice to a consumer who is facing something like that, how to sort of navigate that and kind of get out from underneath that. So that's a recommendation.
Yeah.
Thank you. Appreciate that.
Yep.
And looking at the system as it is now, are there any systemic changes you think are necessary to make this a more equitable system of utilities, one that's more manageable perhaps for people?
Yeah, I definitely do, and I think the panel knows what I think probably, and I'll say a couple words and then pass it over to my colleagues. I mean, I think what we see, we work with patients every day who come to us and are, coming with their social needs issues. I think a lot of our community members need assistance to apply for assistance in many regards. We need a broader team of navigators out in the community that can help people walk through the really complex processes that are a part of applying for utility assistance. And the community action agencies can't do that because they have to process all of the paperwork and do all of that. So it would be wonderful if we could, find some way to create a system where people could find someone to ask for help, even just filling out paperwork or collecting documentation, emailing. The divide with digital literacy might be a component for some people as well. So that's one area that I think we could hopefully make an impact. And then if I don't get a chance to say it later, there's a bill that was introduced last week, Senate Bill 150, that is looking to make some broader changes around who is protected under the medical waiver processes to include groups beyond just people that are in oxygen tanks or have a physical disability, because we think that there should be broader protections sort of at a systemic level. So
one of my biggest complaints, and I understand the why. In order for us to help someone, they have to go through it's called our VR system. We can only take appointments 28 days in advance. The problem with that is a person who needs assistance will have to call us every day to get an appointment. And we've talked with the state about changing that, but my understanding is it's connected to the PUCO and how long they will allow a utility not to be paid.
And what does that acronym stand for? I'm sorry.
Public Utilities Commission of Ohio.
Thank you very much. I appreciate that.
And so you have a challenge where you have people who need help, but our system only allows a certain number of people to get appointments because the state told us that we can only book 28 days in advance. And so it makes it very difficult for people to get help. And as I said, I understand the constraints, but it's a major problem for people who need help now.
So to follow up on that, I think one of the issues, and it's been that way for quite some time, as I stated earlier, with utility service, everything keeps moving forward. So a typical billing cycle for a regulated utility is between 28 and maybe 32-day billing cycle. So if a consumer is making an appointment and the appointment's 28 days out, that means that by the time they get into an appointment, they're going to have another current amount due. So I think those parameters were put in place because, everything kind of keeps moving forward. Typically, the utility company, a regulated utility company, must provide a 14-day notice prior to disconnection. And then, of course, during the winter months, there's an additional 10-day notice. Typically, by the time a consumer falls behind, they're at least a billing cycle or two behind. So they may find themselves, before they get their first disconnect notice, they may already be in arrears 60 days. Then they reach out for assistance. It takes, quite a few days to make an appointment, but everything's moving forward. So, once they make the appointment, again, they're 60 days and they get in to the energy provider to get heat, they have another bill that's due. So it's an ongoing cycle, like we had said, earlier. It just keeps snowballing at that point. So I think that, the parameters for the 28 days is based on the actual billing cycles that the utility companies utilize.
Thank you. And before we move forward, I just want to mention again that if you're interested in submitting questions, you can call 216-307-5632. Again, that's 216-307-5632. Or if using Zoom, you can just put your questions directly into the Q&A box. Want to move on perhaps to look at some of the assistance tools that are available for people right now. And I was hoping we might discuss, to start with, what is PIP, what is HEAP, and how exactly do they help people?
You want to do the PIP?
Yeah. Sure. So the percentage of income payment plan, which is PIP Plus, it is considered an extended payment plan. So for consumers that are at or below 175% of the federal income guidelines, they would qualify for the PIP program. What PIP allows customers to do is pay their utility bill based upon their monthly household income. So if you qualify for PIP, you pay 5% of your monthly household income to the main heating source, which a lot of times I know in the Cleveland area that main heating source may be gas, and then you would pay 5%, to the secondary heat source, which is typically the electric. So typically a household that qualifies for PIP Plus, they're paying 10% of their monthly household income, 5% to gas, 5% to electric. If they heat with electric, they would then pay 10% of their monthly household income. So the percentage of income payment plan, it's probably not, it helps people to keep their utilities on, even though they're spending, to me, quite a bit on their utility, even by paying 10% of their income. If you're low income, that's still a lot. But the program does allow consumers to keep their utilities on by making monthly payments. In addition to that, for making monthly payments on time and in full, consumers can actually receive a credit. So they will get a 1/24th credit toward any outstanding arrearages that they owe. In addition to that, they're not responsible for anything over what their PIP installment would be. So while it may not be the perfect program, I will tout that Ohio, it has one of the biggest, largest PIP programs. It's been around since 1983. We totally revised the program in 2010 to give consumers more of an option to, get out of debt and keep utility services on. So it's available for consumers who are at or below 175% of the federal income guidelines, and it also piggybacks on the Home Energy Assistance Program, which I'll let Dr. Chisholm talk about.
Thank you.
So the Home Energy Assistance Program, of course, we do the payments, but we also do light, gas, and then recently through the pandemic, it was water and sewer. We didn't do that before, and those dollars are about to go away. But for us, we've been doing this almost 40 years, and I think for many people, we're best kept secret. A lot of people who are eligible for our services either don't know we exist or they're afraid to come because they don't think they're eligible. And what I always tell people, it is better for you to apply. Yes. Let us tell you whether or not you're eligible, as opposed to you're not doing anything with it. And then, as you talked about, stress, being, worried about how you're going to pay your bill. Like, we're here.
Let's see.
That's a good point.
Anything you'd like to add on these?
Yeah, they're the experts on the programmatic side for sure. So I can't speak to that. Just that how we, in our program, how we try to help our patients sort of navigate through the processes of how to apply for assistance. And that's kind of where we're positioned to try to help people get to the assistance, make sure they're aware of it, know that it's there, how to access it. But I think even still, it's a struggle for many to kind of get through the process, and can be difficult to kind of get to the end, right, where you get the payoff. So I hope that we can, highlight some of these kind of structural things that maybe we can continue to have a conversation about how to make some adjustments or some tweaks so that our community members are actually going to get a little bit of an easier time in the long run. But
I'm glad you mentioned it, if I may. I did want to get into a bit of, from all of you, how people can get the most out of these programs, what steps they should take, what they should be aware of to maximize what they can benefit from them.
For us, I would say the most important thing, almost everything now is online. And most people, we surveyed our clients, and the majority of them have smartphones. So they have access. So if they go online to our website, almost everything that you need to know is on that website. What documents you need to bring. You can upload it. If you don't have access to a computer, you can come to our computer banks and we will scan the information and upload it for you. So it's really helping people to understand what is available, where to go and get it. Ours is stepforwardtoday.org. Just click Energy Assistance and you can see all of the menu of things that we do. But all of the information is on that website.
Amazing. And for the PIP program, what are some suggestions you might?
I would suggest for consumers who do enroll in the PIP program is to make sure as much as possible that they are making their monthly payments, because there are benefits. If they make their monthly payments on time and in full, they don't accrue any additional debt. And then they also, if they bring debt or they have pass-through arrearages, they bring that to the program once they enroll. each month they get what's called a 1/24th credit on the account. So even after making 24 payments, that a debt that you brought to the program can be eliminated. So I would just say once they enroll on the PEP program, as much as possible to make those payments on time and in full, and remain on the program. They're also required to re-verify every year. To basically what that means is they're recertifying their eligibility. So they have to recertify every year that they're still eligible for the program. Those dates are on the bill. So the re-verification date is on the utility bill. There are a lot of times that consumers will get removed from the program because they didn't start the re-verification process early enough. So they need to basically learn and adhere to the program guidelines, and it can really be a great program for consumers to maintain their utility service.
So the 1/24th, does that mean if they pay on time for 24 payments, the rest of the debt is relieved? How's that work exactly?
Every month that they pay on time, 1/24th of that debt is forgiven on their bill. Yep.
And also to mention again, the number 216-307-5632. 216-307-5632, or just put in the question and answer box for Zoom. Now, I know we spoke about different steps people might want to take to maximize this. One of the things I'm wondering about is the importance of having all of the documentation you need at the moment that you apply. Could you talk a bit about how important that is?
We have so many people who start the application who never finish it.
Yeah.
And the challenge that we have with that is now a person who could help you has to now go back and talk to someone and call people and try to get the documentation while we're still getting applications from other people who need help. So during the pandemic, the backlog was tremendous. And so what we wound up having to do was cut it off at 10 days. If within a 10-day period, you didn't provide us the information, now you had to start all over again because we had 6,000 applications. We were deluged with it. So we try to help people understand. That's what I was saying before about the information being on the website. If you read that and really check off what you need and send this to us immediately, you can get the assistance that you need. But if you don't submit everything, and it's not that we're trying to be, mean or anything. These are not our dollars. These are tax dollars. But the state requires certain documentation. If you don't provide it, then we can't provide the service, period, because we get monitored by the state. And we get in trouble if we provide a service and the person hasn't provided the documentation.
See, and I know there was a concern that I had seen about the time it can take for these processes to work. And I was hoping, Ms. Birkby, if you could talk a little bit about this need to address the fact that demand outstrips staff resources, the number of staff.
Yeah, and I can only, again, I just speak to it from where I sit, kind of just working with patients day to day. We just see so many people that are trying to get through to make appointments, as Dr. Chisholm mentioned, and having limitations to the number of slots isn't anything that they can control, but the number of people that are trying to seek slots is massive. And I don't have the numbers of how many they are, but anecdotally, the majority of the patients that come to the Midtown clinic that I work at have a utility concern and are trying some way to get access to services. So it just seems to me that there's a disparity between the ability for people to get through because there's just not the structural support there for them to do that. And that's probably due to funding and all kinds of various reasons.
So Sharon mentioned during her video that United Way has a new partnership. So United Way will they'll start doing the intake and answering the phones for us, because that was one of the biggest concerns. That we have so many people who are calling trying to get assistance. So now that they're going to take on that responsibility, it will allow our staff really just to focus on processing applications.
Right. And I can imagine with the number of people coming, it's a tremendous burden on staff as well, or stressor on staff. So, in addition to United Way helping to alleviate some of that, anything else that you think is necessary to try to provide you with the resources you need to better address this onslaught?
That's a $24,000 question. because of the pandemic, we lost staff.
Yeah.
And that made it very difficult. And you had more people fall into poverty because they lost their jobs. And so it was a perfect storm. What we try to do in terms of taking care of our people, we have easy work. A lot of us do. So we reminded people of that because it is stressful. And then you have people who are coming to us who are stressed and you know, they're worried. We also created in our building, we purchased bicycles and treadmills, and we just created an exercise center for our staff because we know how stressful it is.
Very stressful.
I can imagine. I can only imagine. I was hoping, you know, we talked about different kinds of utilities are at stake here. Now, I know that during COVID, there was, as you said, water sewer assistance. If you guys could explain to me a little bit about the impact of not having that anymore, and if there's anything that works to provide that kind of additional support now that COVID provisions are ending.
First of all, well, let me say this. I know that we have talked here about programs that are, you know, folks have to be income eligible. But I did want to mention that we do expect that the Commission, the Public Utilities Commission of Ohio, will sign what's called the Special Reconnect Order sometime this fall. What the Special Reconnect Order does is it allows any customer, regardless of income, they don't have to fall within like 175%. It allows any customer who are facing disconnection, or maybe they have lost a utility, they can pay $175 to utilize the Special Reconnect Order and have their services restored or maintained. If the service has physically been disconnected, they will need to pay the $175 plus a reconnection fee, and we don't know what that reconnection fee is yet. And in the past, it has been up to $36. And that program will be available for any customer, regardless of income, because I know at the table today, we've talked about, you know, customers being eligible for PIP and customers being eligible for HEAP, but the Special Reconnect Order allows any customer, regardless of income, to pay a maximum of $175 and at least start the winter off with, or as I should say, as the temperatures cool, you know, get their utilities back on and, you know, get prepared for the winter. So we do expect that the Special Reconnect Order will be available probably sometime in mid-October. As far as the water program, like Dr. Chisholm said, it came out of COVID relief. It is slated to end September 30th. We encourage anyone that's watching today, contact your state representatives, make a push to Congress to keep the water program. And it's a travesty that we don't have a water program. We do pretty well in Ohio with energy assistance, but water is, we just don't have it. And once that program ends on September 30th, we're going to be right back to square one, where folks won't be able to have access to funds to restore, their water services.
And I'm sure it's pretty obvious on its face, but just so that listeners understand, when someone gets their water cut off, the impact on their lives, if you could.
You want to?
Yeah, I mean, we actually had a patient who this happened to them. They'd gotten multiple water disconnections, and this woman had a young son with asthma, and was just sort of at that point of desperation, really. And I think he needed like actual water to go into his machines to help with breathing treatments. And you just, if you imagine anytime I think having no water, no electricity, no gas is something we can kind of all imagine ourselves feeling that experience, and what decisions you have to make as a person when you don't have that in front of you. And if you have a sick child or an elderly family member and you can't go to the bathroom or get water out of the sink, I mean, that's not something that I think we want anybody to experience, especially our most vulnerable.
We don't think about basic needs. And these are basic needs. We take them for granted.
Yes.
Yeah.
Until you don't have them.
I see. And we just have a few minutes before we go to audience questions, but I was wondering, is there anything else people should be aware of with the end of COVID provisions when it comes to utilities? Any other changes people should know about?
I think that's the biggest one, to be honest with you. Yeah, all of that funding that was available, and they literally were throwing it at us. All of that is about to end. And for some people, I mean, it's wonderful to have this forum, and I appreciate, United Way doing this and involving us. But here's the reality. A number of people have gotten used to having it or having access to it.
Mm-hmm.
That's about to end. And so if they're not already thinking about, if you know you're behind in your bill now, you need to start, number one, get in touch with the utility company. We're there to help. We do have people who will sit down and walk someone through the application. But they need to really think about this now. And we've put some of that information on the website to let people know that this funding is about to end.
Yeah.
Now, that will continue doing HEAP. So there's, basic HEAP funding, but we're talking about the additional funding like the Low Income Water Assistance Program, LIWAP. It's ending.
Yeah.
I see. Now, we've gotten a number of questions from the audience. Wanted to throw those your way. And why don't we start with this one? It says, we find that when rehousing people, that they have a debt to be settled before utilities can be turned on. Does Step Forward have any assistance for that challenge?
So if the issue is, are they late on their rent or mortgage, then yes, we do have money for that. But again, for us, it's all income eligible. At one point during the pandemic, it was 200% of eligibility. We've tried to advocate at the state level to keep it at 200% minimally. I don't know how successful we're going to be with that. But I would say to whomever is asking that question, if it is rental or mortgage, that assistance is available, and especially rental assistance, those dollars are still available. And so just look on our website, apply, stepforwardtoday.org.
I see. So when in doubt on any of these things, you look at the website, you've got information that can help guide them to start out in.
And I'd also like to reiterate, if they are trying to get utility services reestablished and there's an outstanding debt, they would be able to use the special reconnect order. Again, we do expect the Public Utilities Commission to sign that. That should be available come mid-October. So the special reconnect order, regardless of income, regardless of how much folks owe, between mid-October and April 15th, they would be able to get their services restored for the $175. They could go to Step Forward and get the $175 through the HEAP Winter Crisis Program once that begins on November 1st. So between mid-October and April 15th, if there's any outstanding debts that customers owe and they need to be able to get utility service reestablished in their name, now's the time to do it. Maximum payment of $175 plus maybe a reconnection fee. But yeah, now is the time. Once the commission signs that order, they would be able to reestablish utility service for that payment of $175. And there's no income eligibility tied to that. So anyone can utilize that.
Thank you. Okay. Thank you. And another point someone brought up is they wanted to better understand how someone can get a medical certificate, requesting the paperwork, having it complete, getting it approved. How do they get it? What's the process involved?
Medical certificate involves contacting the utility company. Mm-hmm. You would let the utility company know that there is a medical concern in the home and that they need to fax or email the medical certificate over to the healthcare provider. Then the healthcare provider would then sign it and they would email it or fax it back over to the utility company. So it's pretty simple. The customer would need to reach out directly to the utility company, their customer service number, and request a medical certificate. Consumers can use up to 3 medical certificates during a 12-month period. So essentially 90 days. Medical certificates are good for 30 days. It can be renewed twice. So they can start the process by reaching out directly out to their utility company.
I see. Okay. And then, we talking about paperwork and so forth, but if someone is filing for that, mm-hmm. What sort of things do they need to have available? Any instances where you see particular kinds of paperwork that people
MedCert is pretty simple. Contact the utility company. The utility company must send over the medical certificate to the provider, the healthcare provider. So the consumer would provide the customer service representative with information of their healthcare provider, and then the utility company would send that over. The provider signs it. They send it back to the utility company. Medical certificate is on record for 30 days. So it's pretty simple. With the HIPAA laws and things like that, the utility company should not ask what the medical condition is. They are simply to provide the medical certificate to the healthcare position or advocate that the consumer would like the information to be sent to.
I see. Thank you.
And I can speak on the healthcare side of it, since we actually process the medical forms. We actually do quite a few of these. So yeah, I mean, the process is actually relatively straightforward in terms of, contacting the utility company and sending it to the doctor's office. But at the healthcare side, you have to have someone on the back end ready to sort of receive it and make sure that there's a physician able to sign, send it back. So we've actually dedicated a small team of people on our end to sort of process those and make sure that we give the call back to the patient. Hey, we actually processed this form for you, so they are aware. And then we do a lot of educating that the medical waiver is not, it's a temporary reprieve. It does not eradicate the bill or take away the balance. So that it's sort of a time saver. It kind of buys them some time, but it doesn't actually eliminate any of the long-term things that they still have to address. So that's how we handle it.
And I can understand just what an emergency would be for someone to require that. I gather from what you're saying, once you get started, it's a rather quick turnaround to get that information in hand.
Depends on the speed of which the healthcare team or the healthcare provider actually responds to that medical waiver. So, there may be healthcare places that don't do these or don't sign them or don't know that that's an option. So I think this is where I sit, which is sort of this connection between the healthcare space and the utility assistance space. And we really should be speaking together more because I think that there is a really strong relationship. And this is a perfect example of that. We're saying as a healthcare provider, it is not safe, it is unhealthy, we are concerned. Therefore, we are going to sign these documents for people. We'd like to see the protected categories expanded beyond just, I think I mentioned that before, beyond just sort of the regular health conditions as well.
I see.
I'll say,
please.
We're more than happy to walk people through the process. And I think for a number of people, they're just concerned as to how to do it.
Yeah.
And especially if they've never done it before. And there's something that we haven't talked about yet, but I want to bring this up. Too many people are afraid and ashamed of asking for help. And because they're ashamed that they don't want, in my family, my mother was eligible for these services. She never asked for them. And that was because she was ashamed to have to ask. But the reality is, we're here because people need the help. They give us money to help people. And so please don't be ashamed. If you need it, that's why we're here.
That's right.
If we don't do anything in this conversation, is to just let people know it's okay to ask for help. That's why we're here.
Yeah.
Right. There's no judgment here. You just want to make things better for them and their families.
Absolutely.
We talked about utilities, and one of the things an audience member mentioned is they wanted to know what utilities are not regulated, and is there anything that can be done about municipal utilities like Cleveland Public Power who don't have a regulatory agency working with them?
Well, they kind of answered their own question. So Cleveland Public Power, as an example, they are not they're not regulated. From my understanding, they're owned and operated by the city of Cleveland, so they would fall under the mayor's office. So as an example of a regulated utility here, we have the First Energy companies, we have Dominion, those are regulated companies. If they're not regulated companies, then they would fall under the jurisdiction of either the city or the township or maybe even the county or something like that.
I see.
And that can be a point of confusion for consumers, I think. And for anybody that's trying to explain how utilities work, you may not know which company you have or what you're with, or if it's a regulated or non-regulated utility. And I don't know that consumers have a ton of choice in how they get which company they are going to be with, but you have less available to you depending upon whether you're with a regulated or non-regulated company. So it's important for the people to know which companies they have.
And I will reiterate one thing, that even if they're not with a regulated electric company, they're still eligible for HEAP services. Right. Okay, so as Dr. Chisholm stated, that money, it's federal money, and that money comes out of the federal government. It is to help all Ohioans who meet the income guidelines. So even if they have Cleveland Public Power or another electric utility that's not regulated, they can still apply for HEAP. Okay, they can't get on the PIP program. I know that we talked about, the PIP program, and they're not eligible for the special reconnect order because those are regulated type programs. But HEAP is available to consumers who are not with a regulated utility.
And then something that we didn't talk about before, we have a call center that was funded by First Energy. Unfortunately, that grant is about to end. But when people started receiving notices that their electric bill is going to go double, triple, quadruple, you could call our center, our site, and find out what are your options. There are other utility companies that are available, options that you have, but you won't know that if you don't call. And I can be honest with you, my husband called. As soon as we found out how much that electric bill was going to go up, we called and saved a significant amount of money.
So they have that option. They just need to inquire about it.
They currently have that option.
Currently have that option.
First Energy, if you're watching, we would love for you to extend that grant so that we can keep that call center open.
Any indication how that might be going?
No idea. We're waiting to hear.
I see.
But it's been invaluable for the residents who've taken advantage of it.
And concerning intake, another audience member wondered, regarding the United Way, how do people sort of have that entry point? Is it through the 211 line?
Through 211.
So they would call 211, that would get them on the road to get connected to you. Okay. Let's see. There was a question about step forward in terms of the water programs. Will you be able to process any applications as long as they're received by September 30th, or?
Usually, yes. As long as it's in before that grant is over, then we can process it.
I see. And another individual is wondering, there's all these different applications. If there's any sort of uniform application for multiple programs, so that you can do the door, in the door no matter what.
Yeah, we would, as far as I know, unless you say otherwise, usually those applications are different applications. We would love for them to have one application, input that information, and we push a button and determine which way it needs to go. But that doesn't exist.
Well, there's one application for HEAP and PIP. So they can apply for PIP through the Energy Assistance application, and they can apply for the Home Energy Assistance Program and the PIP program. But other than that, then no, I know we talked about medical certificates and things like that. Those are all pretty separate programs.
So people just need to be patient.
Yeah, I understand. And one of the issues being the recertification of income. Someone asked, why do seniors on a fixed Social Security income have to re-verify, or do they?
They do have to.
Yeah.
Every 12 months, everyone has to recertify. So that's currently, those are the rules to remain on the percentage of income payment plan. You have to recertify your income every 12 months.
And we also had a question about community navigators and funding. They're wondering, why isn't there more funding for them? Are there any avenues you see coming up to increase funding for community navigators? Anything people should be watching for?
I mean, that's the sort of the dream, I think, right? I think that would be the dream, to have more community navigator type people that are able to kind of provide those services. Within the healthcare space, we from the social needs, social determinants of health point of view, we do employ community health workers, and we also employ college students that we've trained to be essentially like advocates to sort of help guide people through these processes. So there's some movement in that direction. I think for healthcare is recognizing we need to have some, people outside of traditional care that can sort of help people walk through social needs related things like utilities, for example. But I think the funding is always going to be a struggle. Yeah. And so, we need, a great philanthropist to say, I think it would be wonderful to support that. And the community needs it. And let's give some to you and give some to you and spread the wealth. So I think it's a wonderful idea, but something we need to work towards in terms of long-term sustainable funding.
And I just want to mention again that the phone number, if you have any questions you'd like to submit, is 216-307-5632. Again, that's 216-307-5632, or Zoom through the question and answer box. Now, we also have a question about the why it takes so long in their view for heat payment to post for CCP. And I don't know if that's just a question of the staffing issue again, or the just amount of traffic coming through, or what. But
I can speak to it from our standpoint. Once that application has been processed, and this has been an issue that we've had with some utility companies, it would be easier for us to be able to make an electronic payment directly to them. They won't allow us to do that. So we have to cut a check, and then the check has to go in the mail. And then on their side, somebody has to get the mail, open the envelope, and process the check. So there's so many things that could happen in between us sending the check and them receiving it and posting it.
Right, not all much of your control at that point. And coming back to the public utility issue. So someone had said they were recently working with Cleveland Public Power, and were told by representatives they don't accept medical certificates.
Correct.
They want to know, how do I advocate? Who do I reach out to try to change that policy?
So,
Yeah, no, please go ahead.
with, again, Cleveland Public Power is not a public utility. I would probably start with, the mayor's office, whoever is in charge of, the electric company, Cleveland Public Power, and advocate for more what we would consider consumer protections. Maybe even accepting a version of the special reconnect order. So all the programs that we've kind of talked about today are related to regulated utilities, but start with the mayor's office and push forward from that aspect.
And also, don't forget that you have a council person
Yes.
who represents your ward.
Yes.
And they can be very powerful people in this process.
Sure. Thank you, Kevin.
And I was wondering about that, especially with the budget process, the county budget and so forth. Is this a particularly good time then to sort of speak to council members, because the budget process is underway, they're starting to prepare it?
I don't think that there's ever a bad time
Fair enough.
to talk to your representatives. I think the bigger issue is, do they understand? Because if they understand the issue and they understand how it affects their constituents, then they're more likely to advocate for the kind of support that we've been talking about, increasing funding, dealing with some of these regulatory issues. But understand, and I think this is, if we're going to kind of speak truth, there are competing issues, even with funding. So as much as we believe that this is an important issue, what we hear from the legislators, okay, well, you're one of, like, stand in line. There's so many other issues that people are trying to address. I think for us, what we try to do is to really help them understand how these things are connected. That I can't go to work if I'm concerned about my lights, my gas. And the majority of the people that we serve through Step Forward, they're the working poor. They have two jobs to make one income. And so when they get behind in these bills, how do they catch up? But I don't think there's ever a bad time to talk to a legislator. Whether or not it affects whether or not you get additional funding. And truth be told, it can't just be us.
Right. Sure, of course.
It has to be a coalition of people who bring this to their attention and help them understand why it's important.
And not having utility service just have, such a devastating effect on, you can't get ready for work, but then you also have, school-aged children or children in the house. So if you don't have electric, you don't have access to internet, the kids don't have access to maybe, doing their homework and things like that. So it's just a vicious cycle. So we need some real work out there and advocacy and contact whoever you need to contact to get that ball rolling.
And hopefully this conversation could be the beginning of some, just public education. I think, when I came into working in the space, I had no idea how many people were struggling with this issue in Cuyahoga County and the city of Cleveland. And we spend a lot of time talking about a lot of issues, but this one's sort of been under the radar, I think, and not really sort of brought to the forefront as a really key social need in our community. And so I hope that we can at least elevate that and say this is actually a big problem and one that we all should work to address.
And a final quick question. Someone had asked about landlords, renters, and how landlords can be enticed to increase home efficiency. So, the people renting, their utility bills can be more affordable.
So let's talk about the reality of that. For a landlord, in order for them to make their apartments more efficient, they have to believe that it's important to do that. And so there are a lot of forward-thinking landlords, and that's wonderful. But for a number of landlords, for them, they're a tenant and their rent, and they just get money for them. I mean, if you can solve this issue, let's also solve the issue of, slum landlords, because that's another one. One of the biggest things that we have to deal with are landlords who refuse to accept our payments. So the person has already applied for the assistance, they're eligible to receive the assistance, and for whatever reason, the landlord would not accept that check.
Really?
Yes. And we're surprised when that happens. I don't know why it happens. I don't know if anyone here knows why that happens.
I do.
Yeah.
I will add maybe a little ray of hope. As part of the HEAT program, there is a Home Weatherization Assistance Program, or HWAP. HWAP is more of the energy efficiency component of HEAP. So consumers who are at or below 200% of the poverty guideline, they could qualify for what's called HWAP measures. Those measures may look like insulating the home, basement, attic, doors, making repairs to furnace or replacement to furnace, heating and cooling systems, and things like that. Some landlords can work with the HWAP providers to take these measures, but as Dr. Chisholm said, sometimes it's just not important. All they want is their rent. We, the Ohio Consumers Council, would encourage consumers to, use energy efficiency measures throughout their home as much as possible to begin with. But HWAP is maybe a program that landlords can work with the providers to make their homes more energy efficient. If they have a renter in the home that's at or below 200% of the federal income guidelines, landlords can apply and work with the providers to perhaps do some energy efficiency measures to their home.
And the HWAP provider in Cuyahoga County is CHN Housing Partners.
I see. And if we have a moment, I just want to briefly do a brief sum up. If each of you could just 30 seconds or so, give me an idea of the most important takeaway you'd like people to have from our discussion today. If we could start with you, perhaps.
Sure. The most important takeaway I think I would suggest is for consumers, if they are in a situation where they feel like they cannot pay their utility bill, to reach out for help. As Dr. Chisholm stated, that is why we're here, is to help. To make that call initially to the utility company, as reach out, maybe get a payment plan, start the process to get some type of assistance. I would also remind consumers, as much as possible, make sure you are looking at your utility bills on a monthly basis. You'd be surprised at the number of people who don't open their utility bills, or maybe the utility bill is provided, via email. Make sure that you're looking at your utility bill. You know what charges are on there. If you find yourself in a past due situation, start to look for help as soon as possible.
Thank you.
And I would say the same. Recognize that there are resources that are available. Step Forward is one. CHN Housing Partners is the other HEAP provider. Don't be ashamed. Also, don't assume that you don't qualify. Apply, because you might. And I think the most important part for part of this conversation is make certain that you understand what the documentation, because if you apply and you don't complete the application, there's nothing we can do to help.
Understand, Amy?
Yeah, I think my takeaway is just that this is a utility insecurity, utility poverty is an issue for residents of our community and our county. And I hope that we can shine a light on it and start to work towards solutions.
Well, thank you. And so we're coming to an end, and at this time, I'd like to turn back over to Sharon to close our event.
Thank you, Stephen, for moderating today's discussion, and to Genevieve Birkby, Dr. Jacklyn Chisholm, and Tonja Stewart Shaw for an engaging and informative conversation. Thank you to Ideastream Public Media and WOVU 95.9 FM, who live streamed today's conversation. And thank you to all of you for joining us today to advance understanding and encourage engagement and dialogue on this important topic to all of us. United Way of Greater Cleveland's 211 program stands ready to assist individuals and families needing assistance with their utilities. The United Way 211 team is actively working with CHN Housing Partners and Step Forward to streamline the screening and application process for these important utility assistance programs. Information on our next panel discussions will be available on United Way's website at unitedwaycleveland.org. All community conversations are complimentary and open to all. In addition, on Tuesday, October 3rd, from 5 to 7 p.m., United Way will be hosting the Freakonomics of Cleveland in Playhouse Square. The event will feature award-winning journalist Stephen Dubner, who is co-author of the best-selling Freakonomics book series and host of Freakonomics Radio. Dubner also created the popular Freakonomics blog, which has been called the most readable economics blog in the universe. Following his keynote, Cleveland Mayor Justin Bibb will join Dubner on stage to discuss how global and national forces impact us here in Cleveland and how local solutions can impact the nation and the world. More information about the event can be found at our website, unitedwaycleveland.org. Thank you for being here with us today, and have a good afternoon.